afternoon, ladies and gentlemen. I'm Mary Pouton, Assistant Dean for Development at the University of Maryland School of Medicine. It is my great honor to welcome you today to witness Dr. Jill RachBeisel's installation as the Dr. Irving J. Taylor Professor and Chair of the Department of Psychiatry. Thank you so much for joining us. Our investiture ceremonies have become one of the most meaningful celebrations at the School of Medicine. This important tradition allows the university community to come together to celebrate the wonderful achievements of one of our esteemed faculty members. It highlights that endowed professorships are among our top priorities and play a critical role in providing support for our faculty who are dedicated to improving human health. Today's ceremony is one small way to convey the school's immense appreciation also for our donors and to celebrate the power of philanthropy. Now, it's my privilege to introduce today's Master of Ceremonies, Dr. Tony Lehman. Dr. Lehman is the Senior Associate Dean for Clinical Affairs and former Chair of the Department of Psychiatry here at the School of Medicine. Ladies and gentlemen, please welcome Dr. Tony Lehman.
Mary, thank you for the introduction. And thank you all for joining us on this prestigious occasion. It's my pleasure to serve today as the Master of Ceremonies, introduce one of our leaders. Our first speaker this evening is Dr. E. Albert Reese, Executive Vice President for Medical Affairs at the University of Maryland, Baltimore, the John Z. and Akiko K. Bowers Distinguished Professor, and Dean of the University of Maryland School of Medicine. Dr. Reese.
Thank you, Dr. Lehman, and thank you for your kind introduction. Ladies and gentlemen, good afternoon and welcome to this wonderful ceremony. Today we honor Dr. Jill RachBeisel on the occasion of her investiture as the Dr. Irving J. Taylor Professor and Chair of the Department of Psychiatry. We'll also recognize the generosity of the Taylor Foundation for the creation of this endowed professorship. The gift of an endowed professorship maintains a very unique function in sustaining scholarship and in advancing care in a particular field, sometimes over decades or even over centuries. They highlight the esteemed position in which such gifts are held. Our first endowed professorship was established through a gift made in 1929 through the estate of John F.B. Weaver from the class of 1894. Over 90 years later, the impact of this first endowed professorship is palpable by everyone. Today, Dr. Richard Eckert holds the honor as the John F.B. Weaver Professor and Chair of the Department of Biochemistry and Molecular Biology. This demonstrates the perpetuity of these gifts. Dr. Weaver set the precedent, which many others have followed, and they bestow on the University of Maryland School of Medicine now nearly 84 endowed chairs and professorships in various stages of completion and held by several faculty members. This time-honored tradition of endowed professorships, fueled by our visionary benefactors, endorsed the School of Medicine's legacy of excellence. Every success we have enjoyed as an institution since that first gift can be largely attributed to the connection created by these gifts. A special relationship was established between the legacy of the donor, the career of the honoree, and the bedrock of this institution. Each endowment has enabled the department to excel, and by extension, the School of Medicine to flourish. Each endowment has delivered a prestigious level of dignity and distinction to a faculty member. Each endowed professorship has provided a special space for a legacy to live. And each of these allocations have joined together over the years for the grand three-pronged award of life-saving discoveries, superior patient-centered care, and exceptional academic achievements on behalf of the School of Medicine and for the ultimate benefit, the citizens of Maryland and beyond. Over the course of today's program, you will hear from Dr. RachBeisel's colleagues and friends who will highlight her significant career accomplishments, which have earned her the honor through the Dr. Irving J. Taylor Professor and Chair of the Department of Psychiatry. Dr. RachBeisel, Congratulations on this very special celebration of your career, as we honor you for all the contributions that you have made to medicine. Before we move forward with the celebration for Dr. RachBeisel, I'd like to take a few minutes to recognize the donor whose financial contribution made this endowed professorship possible. On behalf of the entire School of Medicine, I'd like to thank Dr. Bruce Taylor and the Taylor family and the Taylor Foundation for the generous contributions which have established this endowed professorship. I'm very pleased that Dr. Bruce Taylor has joined us today for this event. At this time, I'd like to invite Dr. Taylor to share remarks on behalf of the Taylor family.
Thank you, Dr. Reese, for the opportunity to say a few words. I have every confidence that Dr. RachBeisel will continue to lead the Department of Psychiatry with distinction. Rather than talking about Dr. RachBeisel, which I'm sure others will do today, I want to say a few words about my father, Dr. Irving J. Taylor, for whom the professorship and chair Dr. RachBeisel is accepting today is named. To my knowledge, Irving began his career interest in psychiatry in 1939 when he and his father purchased a 12-bed private psychiatric hospital at the top of the hill in Ellicott City. Irving went on to go to the University of Maryland Medical School that year, graduating early in 1943 to be an Army 90-day neuropsychiatric wonder. He was put in charge of 1,200 patients and giving one nurse to assist him. He later completed his psychiatric residency before joining the staff of the family hospital. Irving was always a devoted and caring father to me and our family, but he was equally committed to the hospital, his patients, and advancing psychiatric care. In 1953, he became the second person in the United States to prescribe and use Largactil, now known as Thorazine or chlorpromazine. Frank Ade, another University of Maryland graduate, preceded my father by 2 weeks using this novel medicine in outpatients. Frank and Irving became close friends as they shared the results of their work with the skeptical psychoanalytic community in the Baltimore, Washington area and the rest of the United States. Later, my father worked with each of the new antipsychotic, antidepressant, and anti-anxiety agents once they were past what he called the guinea pig stage. I want to share with you some of the lessons my father taught me as they relate to the mission Dr. RachBeisel will be continuing in running the department. Dr. Irving Taylor felt a psychiatric hospital should be as comforting, warm, and safe as possible. He and my mother worked hard to make the interior spaces inviting, incorporating original artworks and other personal touches throughout the hospital. In an effort to reduce the stigma of mental illness, the public was invited to visit the hospital for art shows, cultural events, and to attend the first continuing education programs before they were required. My dad had a fantastic work ethic. He avoided gossip and tried to avoid saying negative things about others. Each member of the staff received guidance and training. I learned early on that every member of the staff was important to the success of patient care in the hospital. This included housekeepers, maintenance, and dietary staff, as well as those doing direct patient care. He let me know that the housekeeper who observed and reported contraband could save a patient's life. Irving understood that everyone is important to the team. As such, he always listened to what all of the different workers had to say. He reminded me, however, that he didn't feel obligated to make all the changes staff would request of him. Another key quality which I admired was his willingness to explore treatments he felt would be a help to patients, even when others might not yet see their benefit. These included not just electroconvulsive therapy and pharmacotherapy, but also the early introduction of art, music, dance, and recreational therapy, as well as the creation of a number of firsts in specialized age-specific treatment programs for adolescents, young adults, and geriatric patients. Dr. RachBeisel, I know that you will approach your care and leadership of the department with some of these same core values. It is indeed a fitting tribute to my father that his name is associated with this department, which values so highly many of the same core values which drove my father to seek excellence in his work. I wish you all every success as you pursue excellence here. Thank you.
Thank you, Dr. Taylor. Before introducing our next speaker, I'd like to make a few of my own personal remarks about both Dr. Irving Taylor and Dr. Jill RachBeisel. I first got to know Dr. Taylor when I was chair of the Department of Psychiatry. Irv became really an informal advisor to me in that role, and eventually also a good friend. Some important things to know about Irv's career as a psychiatrist. Irv is a graduate of our class of 1943 from the School of Medicine. Following his service in the Army, Irv came back to complete his postgraduate education and served as a house officer at Spring Grove Hospital in Catonsville. In that role, he played actually a serendipitous and important role in the formation of our Department of Psychiatry. A reporter from the Baltimore Sun was eager to write a story on the state of treatment in our state psychiatric hospitals. He asked to be able to visit Spring Grove Hospital, and with the permission of the Department of Health of the state, he came on a day that Irv happened to be the officer of the day at the hospital. Irv toured this reporter and showed him all of the patients and the state of the care of the patients at the hospital. As a result of that tour, this reporter wrote an article that became known as Maryland's Shame, that was an expose on the terrible conditions of patients in our psychiatric hospitals at the time in Maryland. In response to that, the state government passed a number of laws that increased funding for facilities and services at state hospitals across the state of Maryland. Most importantly, one of those funding led to the creation of the Psychiatric Institute at the University of Maryland Hospital, which at the time was a state hospital in downtown Baltimore. And the creation of that Psychiatric Institute constituted the beginning of our academic Department of Psychiatry in the School of Medicine. So Irv really played a key role in helping the department get off the ground. Irv developed his own psychiatric hospital in Ellicott City called Taylor Manor Hospital. Irv was a pioneer in treatment of psychiatric illness, particularly from a biological aspect. In the early 50s, American psychiatry was largely a psychoanalytic specialty. And treatment of things in view of psychiatric illness from a biological standpoint was not well regarded. So it took a lot of courage on Irv's part to stick to that tack. He took part in a number of the early clinical trials of drugs called phenothiazines, which are used to this present day to treat psychotic disorders. And those clinical trials contributed to the scientific literature that led to their widespread use in Maryland and throughout the country. And so Irv was really a pioneer in that regard. On a more personal level, for those of you who knew Irv, you know how much he loved life. He liked to, among other things, at least when I knew him, liked to go out and swing dance. And he always enjoyed that very much. He was very vigorous right up until the last years of his life doing that. I also remember one episode, it was related to the first investiture ceremony of this chair. And Irv got up at the dinner celebrating that investiture ceremony. And after a few brief words, he broke out in a very strong voice, which was baritone, into a song about how much he loved life. I remember Irv standing up in the restaurant, with his arms raised, singing loudly how much he loved life. And it was a very joyous kind of occasion. And I think captured, at least for me, the essence of Irv Taylor love of life. Let me turn now with a few brief comments about Jill RachBeisel. I first got to know Jill in the late 80s when I came to the department as a member of the faculty, and Jill was a resident. During that time, she reminded me that she became an interviewer for one of my research projects in the community, recruiting homeless persons with severe mental illness into a study project. Jill told me about interviewing patients on the street to do diagnostic assessments. That was her first introduction, I think, to psychiatric research. Jill moved up through ranks in the department very quickly. After completing her training, she soon moved into the roles of being the director of our acute inpatient services for both adult and geriatric patients. And she did that extremely well for over a decade. In the late 90s, while I was interim chair of psychiatry, our Division of Community Psychiatry came under great difficulty, and there was a real risk that the hospital would decide to close it because of financial problems. And I needed someone to run that division who would be trusted by the hospital and could set it on its right course again. And of course, I turned to Jill. I remember having a conversation with Jill, trying to enlist her to direct the Division of Community Psychiatry. And she pushed back and said, "Well, Tony, I mainly have been doing acute inpatient work. That's what I do. I really have not been involved much with community-based care." But I knew that Jill was the right person. She's a trusted leader, already had high confidence from the leadership of the medical center, and had great skills to change programs and to manage them well. So Jill took over the Division of Community Psychiatry, and it thrived under her. So she really saved that division as far as I'm concerned. She moved up, of course, in recent years, becoming vice chair for clinical affairs in the department and then interim chair of the department. And I'm so pleased today to honor her as the new chair of the Department of Psychiatry. At this time, I'd like to introduce our next speaker, Dr. Brian Hepburn. Dr. Hepburn first met Jill in 1988 when he served as the associate training director of our residency training program in the Department of Psychiatry here. He helped recruit Jill, but once he recruited her, he moved on to a new position at the state, leaving University of Maryland, Baltimore. He took over positions both at the state and eventually at the national level, directing mental health services delivery, funding, and management. Despite his moving at the time to a state position as the clinical director of the Maryland Mental Hygiene Administration, their relationship developed and grew as both tackled issues related to access to mental health care, education of future psychiatrists, and more recently, advocacy for mental health services reimbursement. Dr. Hepburn.
It is my honor and pleasure to speak about Dr. Jill RachBeisel. I congratulate Dr. RachBeisel for her appointment to the chair of psychiatry, but also I congratulate Dean Reese and his team for choosing Dr. RachBeisel. She will make Dean Reese, the medical school, and the Department of Psychiatry very proud. I first met Dr. RachBeisel when she was applying to the residency program. She was an impressive applicant. She had a BS in chemistry and mathematics. She was an RN, and she was graduating from Penn State University Medical School. On paper, she was excellent. In person, she was even better. She was engaging, articulate, enthusiastic, and had a clear vision of working with persons with serious mental illness. She recognized that those individuals were often stigmatized and ignored. She wanted to make a difference. She wanted to help that population. The Department of Psychiatry at that time was focused on training individuals to work with serious mental illness. The residents in the program worked in the state hospitals or in community psychiatry, working with individuals with serious mental illness. There was a strong relationship between the University of Maryland, the Department of Psychiatry, and the Department of Mental Hygiene in the state. The Department of Psychiatry would go on to be one of the leaders in the country in terms of training individuals, training residents to work with individuals with serious mental illness. Dr. RachBeisel was excited about working in the residency program at the University of Maryland. We were excited about recruiting her. I went back to the admissions committee and said, this individual is great. We need to make her a top priority. I talked to individuals on the admissions committee, Walter Weintraub, George Belize, and others. They agreed. She became our top priority for recruiting into the residency program. She was the ideal match at that time for the residency program. As Dr. RachBeisel entered the program, went through the program, she met all the expectations and exceeded expectations. She became the chief resident in her 4th year. Dr. RachBeisel then joined the faculty after graduating from the residency program. She ran an inpatient unit and later became the director of inpatient psychiatry. She eventually moved to community psychiatry and became the director of community psychiatry under the leadership of the chair, Tony Lehman. Under Dr. RachBeisel, the community psychiatry program has expanded and flourished. She has been an exceptional leader. She listens to the team, she listens to her patients. She believes in doing everything possible to help individuals with serious mental illness to be able to recover. She is expert at taking ideas and creating new successful programs. For example, she participated in the RAISE program, an NIMH program on the recovery after an initial schizophrenia episode, RAISE. That work was done at the University of Maryland through the leadership of Drs. Tony Lehman, Lisa Dixon, Howard Goldman, and Dr. RachBeisel. That early work ended up leading an effort to set up programs around the country very successfully. Now, Dr. RachBeisel is working as one of the leaders in the Greater Baltimore Regional Integrated Crisis System. This has the potential, along with 988, to dramatically improve the lives of individuals with mental illness and/or substance use disorders in the state of Maryland and potentially in the country. Dr. RachBeisel's creativity and leadership will be instrumental to the success of that program. I should say that as I moved through my career in the public sector, I repeatedly tried to recruit Dr. RachBeisel. Although I came close a couple of times, her commitment was to the University of Maryland Department of Psychiatry. She would have been an exceptional state and national leader in the public sector. However, I'm glad she stayed with the Department of Psychiatry. The Department of Psychiatry has a long list of excellent leaders. Walter Weintraub, George Belize, John Lyon, Will Carpenter, John Talbot, Ellen McDaniel, Howard Goldman, David Malott, Tony Lehman, Lisa Dixon, David Pruitt are a few examples. Dr. RachBeisel worked with all of them. She has learned from the best, and now she is the best. During times of crisis, leaders come to the surface. We have been dealing with a public health disaster made worse by a political disaster. During this time, Dr. RachBeisel has been the acting chair for the Department of Psychiatry. Dr. RachBeisel has been a champion for public health and the importance of prioritizing attention to mental health issues directly and indirectly related to COVID-19. She has a long history of prioritizing equity issues and has brought attention to the increasing health disparities during COVID-19. Dr. RachBeisel is a thoughtful, hardworking, inclusive, and creative leader. She will take the lessons learned from COVID-19 and move the department forward. She is the leader that is needed for this time. She is equal to the challenge. Again, I congratulate Dr. RachBeisel, Dr. Reese, and the medical school and the Department of Psychiatry. Best wishes, the future is bright. Thank you very much.
Thank you, Dr. Hepburn. At this time, I'd like to introduce Dr. Lisa Dixon. Dr. Dixon first met Jill when working together with me on a demonstration project at the Walter P. Carter Research Center as we focused on identifying homeless individuals with serious mental illness on the streets of Baltimore. Dr. Dixon's passion for asking questions related to an individual's experience with severe mental illness and the drive to collect data and identify novel, person-centered approaches to treatment was infectious and a major driver in the work Jill has spent her career doing. While Dr. Dixon is now faculty at the Columbia University in New York, directing the Center for Practice Innovation at the New York Psychiatric Institute, they remain in touch and focus on the critical issues of engaging persons with severe mental illness in care. Dr. Dixon.
I was very excited to hear that Jill was to be appointed chair. Never mind that she'd been doing it already for several years, but I asked myself, why was I so happy about this? Why did this matter to me? And I thought back when I first met Jill in 1990, I had just arrived at Maryland. I was an overconfident New Yorker. I quickly learned that I had a lot to learn. The whole world wasn't like New York City. And I discovered that the Department of Psychiatry at Maryland was a place that I could be supported to do that learning and ultimately teaching. A key part of that discovery was meeting Jill. I had not encountered someone, a peer, a colleague, who had such maturity, depth of knowledge, and ability to get things done. I wondered if her tenure as a nurse contributed to this wisdom and competence, that she was trained both as a physician and a nurse. So why was I so happy about this? Because of the kind of leader Jill has been, is, and will be. Over the last several years, our concept of leadership in this country has been challenged. What makes a great leader? I'm not going to talk a lot about the literature on leadership. I mean, there's a lot written about it. I happen to like these qualities in a leader: clarity, decisiveness, courage, passion, and humility. Jill has all of these qualities. And the more I thought about it, my mind drifted to the different types of reasoning we use as clinician scientist leaders. And this gets a little into my head, but in our work, we use both inductive and deductive reasoning. The main difference between inductive and deductive reasoning is that inductive reasoning aims at developing a theory, while deductive reasoning aims at testing an existing theory. So many scientists conducting a larger research project begin with an inductive study to develop the theory and learn and sort of from the ground up begin to understand a phenomenon. The inductive study is followed by with deductive research to confirm or invalidate the conclusion. Both approaches are used in various types of research, and it's not uncommon to combine them in one large study. And why am I going on about this with respect to Jill? Jill is a person who can do both. She can make the granular observations about what she is trying to figure out and what is happening. She can get down to the micro level and suspend her hypotheses and suspend her beliefs and try to learn and be present. But then she can implement solutions. She can take that what she has learned and what has how she understands the phenomenon and spread it effectively. I think the department is in great hands with Jill RachBeisel, and I congratulate her and I congratulate everyone. Thank you.
Thank you, Dr. Dixon. At this time, I'd like to introduce our next speaker, Dr. Mohan Sunta. Dr. Sunta is president and CEO of the University of Maryland Medical System. While Dr. Sunta has been in the University of Maryland School of Medicine since 1995, he met Jill more recently in 2016 when he became the president and CEO of the medical center. Their working relationship evolved as together they engaged in discussions about mental health and addictions and the impact on the individual, families, and our communities. Jill describes Dr. Sunta as the most impactful CEO she has worked with in her 30 years here at this medical center, and finds his enthusiasm, open-mindedness, and broad thinking refreshing and inspirational, expanding pathways for psychiatry to deliver care to individuals across the system. Dr. Sunta?
I want to thank Dean Reese for providing me with the opportunity to make a few comments about my friend and colleague, Dr. Jill RachBeisel. Today is indeed a special day in Dr. RachBeisel's career, but to me it really does represent a culmination of her 30 years of commitment to the citizens of Maryland, and very specifically to the most vulnerable amongst us. Dr. RachBeisel is being recognized as she takes on the helm as the chair of the Department of Psychiatry at the University of Maryland School of Medicine. And this recognition of this responsibility comes as a result, again, of a storied professional career that has been defined around one fundamental concept, and that is the concept of partnership. I've had the privilege of working with Dr. RachBeisel for many years, and most notably, it was my time as the CEO of the University of Maryland Medical Center. During that time, I got to work with Dr. RachBeisel side by side and see her commitment to the most vulnerable members of our community and of society overall. She is a passionate advocate for our community, and she has helped position the Department of Psychiatry as a national thought leader in the management of behavioral health. When you think about Jill and everything that she represents to our institutions, to me, she represents the best of what we aspire to be. She brings phenomenal leadership skills to her role. She also brings an empathetic spirit that helps us engage with each other in ways that are constructive and allows us to recognize that we are better together. And whether that is the relationship that is being forged between the School of Medicine and the University of Maryland Medical Center, or whether it is the relationship with our collective institutions, with our communities, Dr. RachBeisel is on that leading edge of what it means to be a 21st century leader. And so today, let my voice join those who have been offered the opportunity to recognize Dr. RachBeisel, congratulate her family, and let her know that I look forward to years of continued partnership as we look forward to working together to move our organizations forward. Congratulations, Jill.
Thank you, Dr. Suntha, for your kind and insightful words. It's now time to move forward with our ceremony to honor Dr. RachBeisel. Dr. RachBeisel, I'm delighted to present to you one of the School of Medicine's and the university's highest honors, this endowed professorship. This honor acknowledges your career accomplishments and contributions to our academic community. I know that your peers and colleagues in attendance today and throughout the School of Medicine widely will agree that you're most deserving of this honor. And I'm now pleased to present to you this medallion, which signifies that you have become the Dr. Irving J. Taylor Professor and Chair of the Department of Psychiatry. I hope that you will proudly display this medallion and wear it public at major events, such as the investiture ceremonies like this one, convocations, and commencements. Dr. RachBeisel, congratulations, and we would be pleased to welcome your address at this time. Thank you.
Thank you, Dr. Reese, for your kind words and this wonderful opportunity. I also want to thank Dr. Bruce Taylor and the entire Taylor family for your support of the Department of Psychiatry through this very generous endowed chair. I am proud to have the name of Irving J. Taylor in my title. The Taylor name is an icon across Maryland for pioneer work, providing respectful care to individuals with mental illness and in search to identify novel treatments at times where few existed. Dr. Irving Taylor was a mover and a shaker, developing care for the most needy in the communities and for their families. I have spent my career as a community psychiatrist, serving those most in need and most disadvantaged. I am honored to follow in the footsteps of Dr. Taylor's. I want to thank the three people who spoke earlier. Each of them has been a major inspiration to me at some point in my career and continue to be so. Thank you, Dr. Brian Hepburn, for bringing me to Maryland. It was recruitment season, and after many interviews, I was trying to decide how to rank my choices. I remember the personal phone call from Dr. Hepburn, checking in, answering my questions, and sharing the mission and values of the University of Maryland and Department of Psychiatry. That personal, warm, and caring call made all the difference, and I came to Maryland. Interestingly, I had always planned to finish my residency and return to Pittsburgh, where my family and most of my friends were. But what I found at Maryland were colleagues and peers, a team of faculty and residents that were very hard to leave. That same warm, caring feeling that I got from Dr. Hepburn on that phone call seemed to persist. And so 30 years later, I'm still here. Throughout my career, Dr. Hepburn has taught me over and over the value and power of being connected on campus, in the city, in the state, and beyond. By being involved in local and regional institutions that determine care and payment, one has the ability to have a greater impact on decisions that determine the care for those we serve. Brian and I remain connected, and I still call him at times when the forest gets foggy and I can't see the trees. His perspective is always so helpful. He remains a great mentor. Thank you, Lisa Dixon, to whom I will be forever grateful. Lisa arrived on campus after her training as a powerful force and impacted everyone she encountered. I was no exception. Her energy and curiosity were infectious. Lisa taught me that the simplest question can lead to a big change, and that if we don't ask those questions and don't explore for the answers, we will not discover what will make the biggest difference for our patients and their families. Lisa and I remain friends and colleagues, and even though she's moved to the Columbia University and the New York Institute of Psychiatry, we stay connected and look for ways to work together. Dr. Mohan Sunta. Well, as many of you know, I have been at the University of Maryland School of Medicine for quite a while, and I have been through many leadership changes, encountering different styles and having to make hairpin turns to respond to those changes. But I have to say that working alongside of Dr. Mohan Sunta as our president and CEO of the medical center and now the system has been nothing less than inspiring. His energy, open-mindedness, and willingness to take the time to understand a person with mental illness or a substance use disorder and to support the treatments that our patients need and deserve was eye-opening. How many times did I enter his Godelsky office with a question or a request, only to get 5 questions back? Conversations with Dr. Sunta are thought-provoking and challenging, and always with the intention, from my perspective, to identify and do the right thing for those we serve. I look forward to continuing our relationship. I would like to thank my family, particularly my parents, who raised me with a work ethic like no other. Raised in a family of operating many businesses, we learned that if we were going to be successful as a family, we all had to pitch in. We all had to participate. We worked until the work was done. And that work ethic has carried me a long way and has helped me to build teams of success. Our department's success depends on everyone participating, everyone at the table. And like my mother always said, no one leaves till the dishes are done, which takes me to my department. I want to thank the entire Department of Psychiatry, all of the faculty who have been so awesome to work for and with. Your words of encouragement through difficult times and shouts of celebration when we succeeded makes coming to work easy and enjoyable. You all have heard me say the saying, you can get there faster alone, but much further together. And that's how we work as a department. And I look forward to that continued journey. As I step into this endowed position, I look forward to continuing work with Drs. Hepburn and Dixon and Sunta and my entire department and those around me in other departments and campuses. Every support staff, clinical staff, and faculty are part of our team. I look forward to working with our medical center and system to improve the lives of the people that we serve. As I think forward, I have, similar to Dr. Irving J. Taylor, some big ideas and some big plans. And I hope to continue to reach out and connect with our community to provide the care that is needed by the most. We will continue to provide the best education to the next generation of future doctors, but also psychiatric social workers, nurses, counselors, peer support specialists, so that when they are ready to enter the workforce, they're prepared and energized. As an academic department, We will continue to ask those important questions and strive to discover novel treatments so desperately needed. But to do any of this, or part of this, all of it, I will strive to support my faculty in their careers. And my hope is that they find a home in Maryland that I have found. And finally, if 2020 has taught us anything, it is that mental health is important, particularly in a pandemic, and that we are all biased, and that understanding our own biases and being able to listen to, understand, and accept the person sitting across the table is critical to assuring that we are all working towards diversity, equity, and inclusion in our institution and in our communities. I am honored and grateful to be the Irving J. Taylor Endowed Chair, and I look forward to the coming years. Thank you again, Dr. Reese, and thank you all for attending my investiture ceremony. Have a great evening.
Dr. RachBeisel, congratulations on this honor. I want to thank everyone for joining us this evening in this virtual celebration. This concludes our ceremonies. Have a wonderful evening.